Are you nervous for your own health?
That thought goes across my head almost every day I go to work. This could be the shift where I get COVID. And it's a very scary thought, but in my mind, my patients come first. They need the help. And, if we're not here to do it, then who's going to do it?
Nicole, you are an angel because you have been coming to the aid of your country during this crisis. You went to New York, you went to California, and now you're in North Dakota. Why are you going into the eye of the storm this way?
At the peak of the pandemic, when New York first got hit hard, when I heard that people were, passing away and dying alone and they were short nurses, it really lit a fire in me to go and help.
How different is this scenario in North Dakota from that in New York and California?
New York was an experience that I can't even put into words. It was so unique, and we literally went into the worst of the worst. California, we were working in patient COVID tents because our hospital was maxed out and beyond capacity.
But let's talk about North Dakota.
The patients that we are seeing here, they are from rural towns. We are seeing them come in from Montana, South Dakota, Minnesota, even patients from close to the Canadian border. And a lot of them are small town, and they tell me that their whole town has been hit hard. And some of the shifts here actually have reminded me of New York, just because the acuity and how sick they are. Some of these patients that come in, they don't think they have COVID, and they don't believe it's real. They think it's a hoax. Others, you will see a change of heart, almost to the point where they might need a ventilator. You just see the fear cross over their face, and they actually figure out that it is real. It's happening to them, and it's sad that it takes it to that point.
The governor has said that hospital personnel who may have tested positive for COVID-19 but are asymptomatic should report to work in COVID units.
It's kind of a shock to hear something like that. Here we are, fighting the war against COVID and being required to work if you have COVID. I don't think it's right. I don't think it's fair, but I get that they're trying to utilize pretty much everyone they can.
Was there any patient in particular who really affected you?
I had one here in North Dakota. He was elderly. He just was one of the patients that declined and didn't do well. He was able to verbalize to me, tell my family I love them and that I'm so proud of them. And I mean, what do you say in those moments? You hold their hand and you be there for them during the process of dying. And it's really hard. It's hard. Definitely rely on the support of my coworkers, and I always try to call my mom, and she's a nurse as well, so she can understand and be there for me even though she's back in Florida. I worked on Thanksgiving night shift, and it was a pretty steady shift. Even then, our breaks were minimal. I think I had chips and salsa on a 10-minute break. Some of us brought in some Thanksgiving items. I brought in pumpkin pie. Some people brought in chips and salsa. It wasn't your ordinary Thanksgiving, that's for sure. Before Thanksgiving, the floor that I was working on, we were 60% capacity. And then I think we're about 99%. Sure, you might get a hospital bed, but if you don't have the staff to help you, I mean, what good does that do? And then, of course, if we get to the point where we don't have hospital beds, what do we do at that point? So with the rise of hospital admissions and COVID cases, if you don't need to travel, stay home. I will be, FaceTiming and Zooming my extended family. And I think the only way that we're gonna be able to get control of this virus and move forward is if we all do our part in following the guidelines and the CDC recommendations and staying home and doing it out of respect for each other.